Hi, let's talk about the three underlying causes of GERD, that is gastroesophageal reflux disease or disorder, or acid reflux for short. And acid reflux is simply a backup of stomach acid into your esophagus, resulting in that characteristic burning sensation or heartburns and chest pain. And your stomach is by far the most acidic place in your body with a pH of about 1.3. And what happens is this: your lower esophageal sphincter muscle is supposed to close the moment food enters your stomach and keep it from flowing back with the acid that is being now produced. But sometimes this does not happen and you experience a backflow of the acidic content into your esophagus, and I want to tell you why. There are three major causes why you have acid reflux or why you suffer from gastroesophageal reflux disease. And the first cause is low amount of HCl, that is hydrochloric acid. Now there's this misnomer that when you have a reflux, it is because of too much of acid in your stomach, when it's actually the opposite. It is when you don't have enough of it. Rather, when your pH goes from about 3 to 5 and above, that is when you begin to lose the tone of the sphincter muscle and you get an incomplete closure of the esophageal valve of the sphincter muscle. You see, your low HCl would also lead to incomplete digestion, especially with protein, and the biggest symptom is gas and bloating. And you start to have or build up bubbles right in your stomach, and that will leak right through the valve at the sphincter muscle, resulting in that burning sensation and the pain in the esophagus, because the cells there do not have that mucus secreting protection against the effect of HCl. So the first cause is low amount of HCl, that is your hydrochloric acid, when your pH goes beyond 3. And one other factor that affects the levels of your HCl is age. As we get older, the amount of H also drops or your pH goes higher, and this is one reason this condition is most experienced from the middle age to the older folks. And also, if you are constantly on antacids, your HCl would also decrease. So the first cause of gastroesophageal reflux disease is low amount of HCl. Then the next cause is vitamin D deficiency. Vitamin D affects the production and absorption of calcium, muscle, and bone function. And when it comes to the stomach, the esophageal sphincter and the pyloric sphincter, we are dealing with the smooth muscles here, and calcium centers on your contractibility. So the more vitamin D you have, the more calcium absorption and the better the contraction of these smooth muscles. And if you are lacking vitamin D, the closure of the valve at these sphincters will be incomplete, leading to the backup of acid from the stomach right through the valve into the esophagus, and that can damage the cells, creating inflammation at the esophagus. Now, the last cause of gastroesophageal reflux disease or acid reflux is stress or sympathetic dominance or drive. You see, whenever you have stress, you fire off the sympathetic nervous system at the expense of the parasympathetic nervous system. And these two systems are in seesaw dynamics, and so as long as your sympathetic nervous system has more priority and stays high, your parasympathetic nervous system is going to suffer, and that affects your digestion because the parasympathetic nervous system controls the lower esophageal sphincter. So whenever you have stress or more of the sympathetic nervous system or responses such as anxiety, flight or fight mood, you're going to reduce the control of the sphincter muscle tone, and that will allow a backflow of the acid. So stress will also decrease the production of your HCl, that is your hydrochloric acid, and digestive enzymes, and this will affect you greatly when it comes to your digestion and also lead to an acid reflux. So at the end of the day, the three major causes of an acid reflux is: number one, low amount of HCl; number two, lack of vitamin D or vitamin D deficiency; and lastly, stress. If you found this video helpful, kindly give us a like by tapping the like icon you see right on your screen, and make sure you subscribe and hit the bell so you don't miss out on our next video, where I'll be talking to you about the best supplement to treat your acid reflux effectively. Hey, always remember that God wants you healthy. Your health, your life.